Today we're here at the Melbourne Convention and Exhibition Centre for the ANZSNM Annual Scientific Meeting. Telix is a Melbourne headquartered company, so it's great that we can celebrate everything about nuclear medicine in our hometown here in Melbourne.
I say to many people, we are in a golden age for nuclear medicine. There is so much activity, so much development. It's been the confluence of a number of factors, such as developments in chemistry, developments in biology, especially identifying unique receptors and biomarkers that exist on the cells, in particular in cancer cells, but it won't be limited to cancer, what we do in the future. It'll spill into other areas.
There's a great mix of different individuals and parties, from nuclear medicine technologists to scientists to people who are at the cutting edge, and being able to spend time with each other to talk about ideas, to talk about what's being thought about and what's being developed. And it gives us the opportunity to actually see those ideas through.
I have been very amazed at the amount of innovation that is actually going on at this meeting, from both the physicians and the scientists, but also as well as the technologists and the things that they're stepping up and bring novel ways forward to actually help with patient treatment.
It's great to be at Melbourne. The city with ANZSNM together just highlights the immense amount of collaboration, diversity, incredible people, and the intense amount of data that's being shared here.
It's good to be back here in Australia. It's nice to be collaborating with colleagues and looking at all the incredible things that are going on in molecular imaging and therapy. So I am immediate past president of the Society of Nuclear Medicine and Molecular Imaging. I got invited back to do a presentation on what goes on with USA Theranostics and what progress we've made in the last couple of years, share some vision with colleagues, figure out how we can work on workforce pipeline and figure out how to keep pushing molecular imaging and theranostics forward.
It's been a good meeting covering a lot of different things. I think particularly some good review sessions, but certainly a lot of research trials that have been presented here, particularly in the oncology space, but neurology has also featured. So yeah, it's been a good meeting.
So for Telix, events like this are critical. It's a really good opportunity as an Australian homegrown company to show that we have not only evolved the sector, but also that we're giving back as well. As a key partner and supporter of the event, that we can bring people together and hopefully foster, future collaboration.